Welcome back to part 2 of this exciting episode. We're diving right back into our fascinating conversation.
That's right. And if you haven't listened to part 1 yet and you want to catch up, we've linked to it in the show notes.
Yes, and don't worry if you prefer to jump in now and catch up later. That's perfectly fine too. Now, let's pick up where we left off and continue on.
I'm so intrigued. I had no idea. I knew it would take a lot to take care of a horse,
Yes.
right? And certainly, we're talking to a veterinarian here.
Yeah.
Equine veterinarian
Equine
at
vet, I
that.
know.
But there's so much that I did not know about, like the deworming, mosquitoes, because you always hear about the flies, right? And you
Yes,
see their
the flies are
gorgeous
all-
tails, swinging and hitting the flies. But I didn't even think about that. If they get bitten by a mosquito, right? One, it can penetrate that
Oh,
thick
yeah.
ho- Really?
Yeah.
And does it take like more than one mosquito or a whole bunch of mosquitoes in order to, give them some awful virus? Or
It only takes one.
really?
Yeah.
So we were talking about how they have to have a good diet and they should be eating lots and lots of hay. But that's a horse that you are taking care of. What about the horses in the wild?
So they actually eat a lot of the native grasses.
Okay.
They'll do a little bit of foraging on bushes, but they're much more on like the sea grasses, that type of thing. And most of the wild horses are on the low end of what we call our body condition scoring system. So they stay a little bit on the skinny side because they aren't on as high a nutritional plane.
Are there different types of hay that horses eat?
Oh, there's lots of different
Oh,
types of
really?
hay.
Oh.
Tell me about that. Yeah.
Tell us.
In North America, our common ones are alfalfa. It's going to be your steak and potatoes.
Okay.
It's high. It's our highest quality, highest nutrition, highest calories, all of that. Most horses can actually do very well on a diet of just alfalfa hay.
Okay.
Then from there, we have some grasses. Timothy and orchard are probably the most common. Those will often be mixed with alfalfa. They'll be grown together as a crop. So you'll have what we call Timothy alfalfa and orchard alfalfa. So we'll put those hays together. And then regionally, we have some hays like coastal, teff, brome. Those are all just grasses. So it just depends on your region what you get. The one problem we have, most hays do not contribute to colic. Coastal hay will. So
It's also the cheapest, so
Yeah.
it's the most commonly eaten. Yeah, of
That
course.
kind of makes sense.
and coastal is a common hay from Texas sort of around through Florida.
Okay.
It's
Oh.
our most common locally grown hay. And it does carry a colic risk with it though, because of sort of how they digest it.
So how do you supplement if that's their primary, what they primarily eat, if they're not getting the alfalfa one?
Yeah. So we'll take our coastal hay horses and we'll put them on a little bit of alfalfa too.
Okay.
So it makes it more cost effective. We can use the locally grown hay so we don't have as much shipping cost, but we can add in a little bit of alfalfa to minimize that colic risk. And for most horses, they should be getting around 2% of their body weight in hay. So if the average horse weighs 1,200 pounds, that's 24 pounds of hay a day.
Yes.
Live.
Which, by the way, any other supplement, like how we take supplements or vitamins, is there any other supplementation?
For the most part, we go with a base diet of hay because that's what they should be on. And then any deficiencies that we may have from those hays, we supplement with what we call concentrates, which we used to call, and we often still do call grains because they were grains. Like they would be oats, barley, corn. Now, much less are they actual grains.
Okay.
They're, think about like dog food or cat food, right? They're a mixture of some of those grains along with what we call vitamin and mineral packages. So
Okay. That's what I was thinking,
Those
like-
vitamins and minerals you take, like think about Centrum, something like that, that will be in the concentrate along with making sure it has proper protein levels for a horse. So based on their exercise, their lifestyle, we'll take that concentrate and we'll supplement it in for what they need.
So we've talked about their hooves. We've talked about their digestion. What about their teeth? How do you take care of a horse's teeth?
Yeah, and they have a lot of them.
Those
it
are
looks
big
like.
chompers.
Right.
Yeah.
Very carefully.
Oh,
Okay. Yeah, seriously. Don't want to get bit by those.
Yeah.
No, thanks.
We do, during that vaccine exam that we do twice a year, we'll do sort of a quick oral exam on them. Most horses are pretty amenable once you get the technique down to how we'll check their teeth without sedation. I can't do a great exam, but I can sort of get an idea of how things are going. If we have a performance horse, we recommend that once a year we do the full shebang. And that is that we sedate them, which will become obvious why in a moment. And that's because we need to put on what we call a full mouth speculum because they will not hold their mouth open for me. I don't get to say ah. So we open up the mouth, we shine a bright light in there. You think about when you go to the dentist and they do that exam where they're like checking every tooth. We do that same thing. We check every tooth, see what we've got. And then we go in with a large file. Ours are all actually power equipment that we use. And it's because horses, unlike you and I, they start with a large tooth and then that tooth erupts through their lifetime.
Oh.
So they don't actually grow tooth. They start with a really big one and
And
then
then
they sort of chip away at it.
wow.
And so that chipping away process can happen, much like their feet, not 100% properly. And so we go in once a year and sort of even things up and make sure that they're wearing those teeth properly. They can also do like you or I and get cavities. They can fracture teeth. They can do all of the same things. And so we need to make sure that they haven't done some of that. And do we need to go in and address some of those other dental problems? So once a year, we'll do that. We also, again, with these high performance horses, we were talking about how with a lameness, it may be that the right leg just doesn't come up as far as the left leg kind of deal. Well, if you take your head, put your jaws against each other and move your head, you're going to find that your jaws move against each other. Your upper and your lower jaw move. Well, when these horses are being judged on such precise movements, if there's a catch in that, we can have a catch in the gait, right? And so we want to be really careful that we don't have the teeth adding to that. And so we'll make sure that the teeth are appropriately smooth. They need to be smooth, but not too smooth. So we'll do that to make sure that their performance is where it needs to be.
What are some of the signs that there might be problems with the horse's mouth or its teeth?
So one of the big signs is nothing. Horses are really good at hiding that because, again, they're a prey species.
Yeah.
And so they don't necessarily want to show us that they have a problem. But I am constantly amazed. I will open up mouths and have fractured teeth, and I'm like, dude, you got to tell us.
Yeah. Give us a sign, something,
something.
anything.
Tell me something.
Yeah.
Yeah.
But other signs are usually that they're eating weird. If you watch them chew, they're not moving their jaw like you expect them to. They're dropping grain. If they have a really bad tooth, the most common sign I see is that they walk up to the food bowl ready to eat, but they won't actually eat. They're enthusiastic. They're excited
Sure,
about it.
because they're hungry.
They're hungry,
Yeah.
but they've got a tooth that's really
They know it's
loose.
going to cause pain.
Yeah, and so they know it's going to cause. Oddly, they will eat hay, but not their concentrate.
Oh.
Don't ask me about that one. It is a question I would like to ask. Like if I'm ever able to ask a horse a
Right,
question,
get an answer.
that's one of them I'd like
They
to
turn
know
into
the answer
Mr. Ed.
to. Yeah, but it is impressive how
Sure.
often the sign of a massive dental problem is nothing.
Oh, wow.
The other problem we'll see though is a very, very, very smelly one-sided nasal discharge.
Oh.
And it's if we can all remember getting our wisdom teeth out, one of the things they would tell you is be careful because your sinuses are right there.
Yes.
And that's true of horses as well. When they're young, their teeth are 5 to 6 inches long, and then that slowly erupts. So that tooth is actually pushing the sinus up.
Oh.
And if they get an infection, it can very easily go into the sinus cavity.
Oh.
And nothing's stinkier than a sinus infection.
Oh, really?
Ugh.
They stink. Ugh.
Yeah, it smells really bad.
Oh, wow.
And so they'll get a discharge, but it'll only be out of one side of their nose.
because
the
that's
side.
where the tooth is
Yes,
hitting.
the side the tooth is,
Oh,
is
wow.
on.
That's why ponies have those big old teeth. That makes sense.
Miniature horses in particular are the worst because they have all the same teeth, right? But they're crammed in this little tiny body.
Yes, they have those big old mouths.
And you mentioned on your farm that you have 2 donkeys and that the donkeys are like the companions to the horses. What is that relationship like?
Yeah.
Horses are herd animals.
Okay.
Like they feel comfortable when they're in a group. And the same as like in any herd animal, sheep or cows are the same way. Like when they're with a group of their peers, especially when they can be in the middle of it, then they're comfortable. They're safer from prey or predators, all of the things. And so a horse by itself is by himself. And that is a really lonely way to be in a way that we would never understand because we don't have that. Like we're social, but we're not herd animals in the way that they are.
Wow.
Is there anything that we haven't asked you about horses or just your area of expertise that you'd want to share that you think our audience should know?
I think the biggest thing is that if you manage your horse on a day-to-day basis, you have a great relationship with your veterinarian, you have professionals around you who are fantastic. The more of that you do, the less problems you have. And horses are one of those things where it definitely pays to not go cheap.
Mm-hmm.
We always say that the more expensive the bag of feed, the less it costs. It's higher quality food.
that
You're
makes
going to feed
sense.
less of it. It's the same with good veterinary care. You're going to see me less on emergency. Good farrier care, you're going to see them appropriately and you're not going to have as many lameness issues. So going for good quality care is the cheapest way to manage a horse.
But even that can be expensive. Does CareCredit, the CareCredit credit card, cover some of that?
We love CareCredit.
Okay.
Because horses, as we talked about, are great at emergencies. And if you
Mm-hmm.
haven't really planned for that, then you need a way to cover
Yeah.
that. And the colic surgeries can get very expensive very fast. But even a routine colic for us, it depends on the region of the country for sure, but you're looking at, $400 to $800 that you need sort of right then. And
Oh, I'm sorry, go on.
no, so CareCredit has been fantastic for us many times at 2 a.m.
That's amazing.
Is there insurance for horses?
There is.
Oh, is there really?
Yeah.
Is it like pet insurance, but horse
Horse specific?
Yeah,
Horse
it's a little bit
specific?
different than pet insurance. They are, for the most part, insured for major medical things.
Okay.
So, for example, I have my horse insured for surgeries, like things I can't do, right? Surgeries. She's insured for major medical issues. That GI tract can go horribly wrong with diarrhea is one of the big ones.
Oh.
That's fun. It's a lot of diarrhea.
Oh.
Yeah. And eye emergencies. The equine eye can
Oh.
go horribly wrong very quickly and cost lots of money. And so equine insurance is much more of a mortality and disaster management.
Okay.
It can also help us when we're looking at those lamenesses and we're trying to do some of those advanced diagnostics. We'll get into MRI, CT scans, all the same things that you would go through.
Right.
We can do on horses, but the dollar amounts can add up very quickly. And so insurance can really help us with some of those things.
Yeah.
Yeah. Yeah, we'll often have people do a combination of, like they have insurance, but CareCredit helps them,
Okay.
sort of fill that gap kind of
balance
deal.
it.
Yeah.
I think when you really look at the expenses of the horse across the board, there are some things that have to be up front, and then there are some things that are predictable. Like if your horse is going to be on the standard of medical care, that it's going to get vaccines twice, it's going to get a dental float, and those things, and that's going to run you, say $500 a year. Like you can plan ahead on these things. I have to have upfront money for this. Like the routine medical care that I know I'm doing twice, I can put that on the CareCredit credit card and spread that out over a few months.
Right.
And that helps you manage what is always going to be a tight budget unless you're just made of money, and most horse owners aren't. So
Right.
it's a great way to help kind of budget yourself as smart as possible and put your dollars to work for you.
Wow.
That was very succinct, Justin. Thank you
Yes,
for that. I
thank
appreciate
you.
that. We talked about there being this wide spectrum of how much it costs to buy a horse initially. What are some of the factors that influence and affect the price of a horse?
I would say depending on what it is and what it's for.
Okay.
So most people, when they buy a horse, they want to do a particular thing with it. And for some people, that's trail riding and just going out with their friends in a national park and riding trails. For some people, it's show jumping. It could be barrel racing. It could be driving wagons competitively. It could be a million different things. There's a lot of horse sports in the world. And so whatever discipline it is that you're interested in, there's going to be beginner level athletes all the way up to professional level athletes. And the price varies accordingly. So based on what it is, what breed it is, what sport it's into, how much training it's had, and like how much you're willing to put into that, how high you want to go with it.
A lot of these horses aren't born with these skills, right?
Right.
You think about an
gotta teach 'em.
athlete. Yeah.
Yeah,
You're
training.
not born a NFL player. You got to put some work into
Yeah.
it. And so the same deal there. And so that will really strongly affect the price.
And bloodlines too. Like that's a big
Oh,
deal, right? When
yeah.
they get to if they're Kentucky Derby racing horses, right? Because no, I'm just saying,
No,
I feel like I've
this
heard
too.
about that.
Yeah, the different breeds, right?
Yeah, many of our different disciplines, at this point in horse and human history, we've bred them to do things. So if you think about like racehorses, they've probably been purpose bred for the longest of anything out there. And so they're very purpose bred. You can talk to racehorse people and they can say, oh, this line throws turf runners that run 1.25 miles. This line runs, this one throws dirt runners that do this. The lines are very well known what they do. And the jumping in the dressage world, with what I do, we have lines that are known for throwing Olympic type horses. We also have, so for any discipline we do, we have lines that are known for that. When it comes to cutting, barrel racing, you name it, there are definitely purpose-bred horses for that. And we always say you can't ride the bloodlines. So it's a good idea, and you're more likely to get something that will do what you want, but not necessarily, because they're horses. They'll do whatever they want.
Wow. That's amazing. Now, are there some ways that you can reduce the cost? Like not like DIY things, but what are some, ways that you can reduce costs?
Educating yourself will really save you a lot of money in that too, because there's a lot of advertising for a lot of products out there that are all magic cures and magic elixirs. And the supplement world in horses is just like the health food store for people.
Really?
That there's 8 million things on there, and there's no regulation on if they actually work or do anything. So knowing what your horse actually needs and what you can do to impact it and what's not going to impact it will save you an unbelievable amount of money.
That's so cool. And being married to an equine veterinarian will save you a lot of money.
I think he would argue that it has not saved any money.
I can see that.
So someone else's horses are always cheaper than having your own.
Yeah, that's so true.
If you don't have the full budget to get into it, I think leasing a horse is a much more cost-effective way to be involved without taking on the entire burden.
The whole financial responsibility.
Right.
That makes sense. Leasing, gosh, isn't that funny? You can lease a horse.
How important is it to find a community of people who are just as interested in horses as you are?
I would say it's very important.
It's vital,
Yeah.
Chairman? Yeah. Why?
You need the support. Their horses are going to break your heart, but also just having the people and the resources to go to when you have questions. I will say that there's a question that you don't always need to take to your veterinarian or your trainer. Maybe it's how do I pick my horse's feet out? And having that community around you that you can go to. I would say it's just like fashion and hair, like you want to go and ask, like, how do you feel about that new saddle pad that's out there?
Right.
That community, I think, really adds a lot to helping you care for your horse the best you can, for sure. There's always new things out there, new stuff to learn, and you'll never know everything there is to know about horses. So having someone that you can go to and talk to and pick their brain, all of that is really important.
Yeah, that's cool. It's like having those, mom support groups.
Yes.
Exactly.
Yeah, it's the same thing. That's so, I
there
bet
were-
there's tons too now online.
Yeah.
Facebook groups and Instagram, right?
I suspect when you were a new mom, there were things that you were like, oh my,
You don't know what you don't know.
Yeah.
Yeah.
this is horrible. And someone was probably like, it's gas. It'll
It's
be
don't
fine."
worry.
gas.
Yeah.
It's fine.
Yeah. And so having
Totally.
that support group around you to be like, I know that seems like a big deal, but it's not. Or nope, that seems like a little deal, but it's a big deal.
Yes.
Those are important people to have around you.
So true.
Yeah.
So helpful. Wow. And how do you find, like you said before, there are search engines to find you or how do you find a good farrier? You said it's so important to find a good farrier, a good equine veterinarian. How do people find that?
Well, I come from it from the veterinary standpoint. So I always say have a great relationship with your equine veterinarian.
Okay.
And we're easy. We're very food motivated. Bring us a
Bring
cookie.
cookies?
Yeah,
I knew it.
we're easy. Bring us a cookie. But I will say checking in with the equine veterinarians in your area is a great way to start to say, okay, who are the farriers you recommend? Who are the trainers that you have? We have access to lots of people that we talk to on a regular basis. We have equine nutritionists in our stable, all of that kind of stuff that we have access to that we can point you to help you with
cool.
anything in your horse world. But starting with the veterinarian as a trusted source, I think, like I said, I come from it from my side, so I'm a little biased, but I think it's a great source of information for
Yeah,
you to
that
go
makes
to.
sense.
I think when you realize that the veterinarian, like the professional horse community, that everybody knows each other in that region. So all the veterinarians know one another. They know all the farriers in an area. They know all the horse trainers in an area. So like that community all knows each other. So finding someone in there, they can point you to other people within it.
That makes sense.
Yeah.
Yeah, it's a community.
Yeah.
We've talked about having a relationship with the horse being therapeutic for us, but are there therapies for horses?
Yeah, and the more we do with them in terms of athletes, just like our human athletes, the more we need therapies for them. One of the big things I start with, though, is that horses want to be outside. So if you're in an environment where you can't do that, like maybe you're in a large urban area and so your horse is not necessarily, able to be turned out a lot, making sure that they can go out in some way, shape, or form. You get on them and you go for long walks on the beach.
Yeah.
Like taking them out for a lot of movement is a big deal. If they can get out for even a short period of time with other horses, either with them or close around them, that is a great way to keep them happy. And that's the most important therapy you can do for them. When we start adding on some of the other things that are out there, just like for people, we can do lasers. We have all these electromagnetic therapies, massage, you name it. We have all these these really fantastic things.
It's amazing.
They
I know.
add a bit,
Sure.
right? But
Right.
and you can do it as I tell most of my owners, you're thinking of it as, this is nice. You're adding this on as
Yeah.
like
It's
a
a
spa
bonus.
day.
It's
yeah.
a spa day. Yeah.
Yeah. But even the elite athletes will tell you that those advanced therapies are giving them, 0.5%. Now, when you're running at the Olympics, that's a big deal.
That matters.
0.5% wins versus doesn't even place. For the rest of us, it doesn't matter terribly much. But most of those things, I think, are fun to think of as a way that you're spoiling your horse. And we all want to spoil our horse. And there are some times when we have horses with injuries where we will go to some of those therapies. In particular, there are like the electrical stimulation therapy, like you think of like TENS. We have several versions of those that we use in horses, and we'll use them when we're doing rehabilitation for horses with injuries. We'll do some of the injections that you've heard of, like, again, the elite athletes in the human world having. We're lucky we don't have to send them to Europe for some of them. We
Yeah.
can do them
For
here.
some of these injections.
But we can do those sorts of therapies on these horses and help them get back. But a lot of it is, again, it's elbow grease. It's that you're doing the hard work of making sure that they're warming up appropriately before work, they're stretching afterwards. All of those things are the more important things. But if you want to get them a massage because they like it and it feels good, I think that's reasonable too.
Oh, wow.
I've read that they can get chiropractic adjustments as well.
Yeah, chiro, acupuncture, you name it. If you're a human and got it, we can probably do it on a horse. And again, some of them love it.
But it's like kind of extra, like you're saying, like in a way for us. What is the earliest a child could start riding horses? Or what do you recommend?
Well, I started at 3, but
3. Wow.
But she also turned into an equine veterinarian.
I mean, there is
You gotta
that.
be careful.
There is
Yeah,
that.
that's true.
Yeah.
It's a very costly
It's
hobby.
gateway.
Yeah.
It's a gateway.
Yeah, it's a gateway. I know. Wow.
But generally, we find that in the 3 to 5-year-old range is when most of the
Really?
kids will start doing some riding, and it's little stuff like they don't have the attention span or the muscle strength to do it
Right.
for long, but you start doing it a little bit and
Pony camp.
Yep, pony camp. Yep,
Yeah,
build up
that's
from there.
Cool. And then on the opposite age of the spectrum, what about senior horses? What's the care for senior horses?
lot.
Okay.
Yeah. A couple of things that we have happen is because those teeth are erupting throughout their lifetime, typically around 25, we start to run out of tooth.
Oh.
So they've actually outlived the teeth that they have. And we don't have the availability to do dentures.
Okay.
Not really an option for
Not
us.
yet. Yeah.
Not yet.
Maybe in a few years.
Maybe, you don't know.
So those horses end up going on specialized diets. So they'll be eating more of what we call that concentrate. They won't be able to chew the hay as
Like
well.
a liquid diet.
Yeah, so we have to go with the concentrates in a slightly different form that the hay is in it, but really chopped up. More of like a smoothie diet.
Almost like Ensure.
Yeah,
Yeah. for
exactly.
older people.
So they'll go on that more so than they will the roughage diet. So, the teeth are a big deal for us. They start to get infected around them. Like we end up with a lot of dental care on these older horses, just managing them. And so where we're doing the floats on the younger horses to help their teeth erupt properly on these older guys, we're helping their teeth expire appropriately.
Right.
So dental care, huge, huge, huge in the older guys.
How do you assess their quality of life as they're getting older?
I always tell my owners there's something that is your horse. Like at food time, they hold their leg up, or, they have sort of a sassy hair flip that they do when they're excited. There's some behavior that is your horse.
They kick the stall door when it's feed time.
So when they aren't doing that behavior, then it usually tells us that we have pain somewhere and we need to really evaluate what's going on. Because certainly walking around on your toe for a lifetime is less than ideal. And so they will develop arthritis. Just like in humans, we can manage that with pain medication. We can do targeted joint injections of those areas that are most effective. We have a lot of therapies we can do, but we can't necessarily do hip replacements. We can't do some of those things that we do in humans. And so we need to evaluate, are we at a point where this horse is no longer comfortable? They're not banging on the door at 3:30 because they're painful. The other thing we look at is weight. Are they holding their weight, or are you having to increase the amount of food you're feeding them? Pain is very metabolically expensive. So you burn a lot of calories when you're in pain, and it gets harder and harder for these horses to keep up with those caloric needs. So when we find that we're going down on the weight, then we really start to say, okay, let's assess what's going on and see what we have for options.
Man.
It looks like it's time for one of our favorite segments. It is called
Yes.
Ask the Expert. So these are questions that come in from people who are really into care experts, and they have questions and not always the access to the experts. So we are going to ask the questions for them.
Yes.
Great.
A lot of great questions today. Okay, the first one is, what is the average horse lifespan and what factors influence how long horses live?
I would say the average lifespan is probably 25 to 30
Okay.
for most of them. One of the biggest things that impacts that is care earlier in their life. So again, that routine dental care doesn't seem like a lot when they're 10, very important when they're 25. The other thing is what they've done. You know, have their feet been maintained so that they don't have arthritis prematurely, some of those sorts of things. So that is the controllable things that impact lifestyle or lifespan. One of the biggest things we lose older horses to is a type of colic that we can't really predict, called a lipoma. It requires surgery. It can be a really bad type of colic, and I will say it is one of the reasons that we will lose these older horses. So there's not much we can do to prevent that. It is, like I said, a surgical disease. It's one of the more expensive colic surgeries we do. So lipomas are one of those you can't manage. But arthritis and teeth, you can do as much as you can for when they're younger, and that will help you get all of the happy quality life you can out of them.
Yeah.
Here's another one. How can I tell if my horse is at a healthy weight, and what are some of the signs of obesity or malnourishment?
We have a lot of educational videos on our YouTube, but and this is where I learned so much about horse stuff. It's like you can weigh a horse with a measuring tape. So we measure around the girth, and we multiply that by itself, and then measure the length of the horse from the point of the shoulder to the dimple in the tail muscle. So you multiply girth times length,
Okay.
and divide that by 330. And my big question is, who figured that out?
I'm like, yeah, that's a very
That's what I wanna
specific
know.
number.
That's a very specific
It's
formula.
a
Yeah.
crazy
Yeah.
system, but it works.
It
So
works.
anybody
340.
can measure their horse, and we
Okay.
recommend that you do that on a regular basis, say like once a month, and just keep a chart.
Oh, okay.
This is my horse's average weight, and then you've noticed like if they start dropping, because looking at them you might not notice.
Well, also, how would you ever get a horse on a scale? I mean,
I mean,
has to
maybe
be a
stand
big-
still. Like,
yeah.
stand
You know,
right there
big
just for a
scale.
second.
stand still.
Yeah.
Yeah.
They have to be someplace with a scale. But there's also really great resources available on what we call the Heineke Body Condition Score. You can Google Body Condition Score horse and they'll usually come up. But what we're looking for are fat pads in specific areas. And so one is behind the shoulder. Another is the crest of the neck. So where the mane is, we're looking to see is that area getting thicker. It's a big place they put fat. And then on either side of the tail. I always say that you should be able to see the tail when you're looking at your horse from the side. So you should be able to see the entire tail from the top to the bottom.
Oh.
Some of these horses get so fat
That you can't see the
that
tail.
you can't see the top of the
That
tail.
makes
You get
sense.
a fat pad.
I'm going to notice this
Now
next
I'm
time
gonna
I'm
be,
at
yeah,
Will
notice what you
Rogers.
notice. I'm gonna be paying closer attention now. I see
Yes.
horses.
And then your horse's back should never be a rain gauge. So they shouldn't be able to hold rainwater.
Oh, yeah.
in
You-
their,
I wouldn't
yeah, where
think
their
so.
spine is. But
Right.
you'd be
Okay.
surprised.
Oh, wow.
And we have an obesity problem in most of our horses because, again, they were designed to perform or to be out in the wild eating low quality
right.
forage, moving a lot. We put them on the couch in front of a video game and give them Doritos.
Oh,
And here we are.
same problem as parents.
Yeah.
Got it.
Yeah.
Okay.
Yeah.
Wow. Okay, this is another question. How do horses sleep and how much rest do they need each day? Is it okay if my horse lies down a lot?
Most horses will do a lot of sleeping standing up. There are a lot of horses, though, who have adapted to the human environment and they are just fine taking a nap. Laying down, sleeping flat out.
Wow.
I will say most horses won't lay down for longer than about an hour at a time. They may do that multiple times through the day. And they don't tend to sleep really deeply like we do. They will almost be napping, right? So noise, something like that, will startle them awake pretty quickly. Because again, remember they have to watch out for that mountain lion. You
They're
never know
not-
where it could come
Yeah,
from.
they can't deep sleep.
And they need to deep sleep about every 3 days. So
Oh.
they will usually lay down, no matter what, they will lay down and sleep at some point every 3 days. But they can also sleep standing up.
That's also a place where the herd dynamic really impacts the quality of that rest. Because if they have a friend that's going to be awake on watch, they're more comfortable being asleep. If they're by themselves, then there's nobody looking out for them. They have to sleep and be alert at the same time. It's a
Oh,
lot
that
more
makes sense.
stressful.
Yeah, that makes sense.
And it's one of the big things that we look at in horses. You know, those older horses' quality of life. Are they getting good sleep? Do they feel okay being able to lay down and stand up? And again, are they in a happy herd dynamic where they feel like they can sleep happily?
How much horsepower do horses have?
That's a great
Where did the
question.
word horsepower come from anyway?
Yeah, I
Making
know,
that
right?
question up. Yeah.
I think it depends on the horse.
This is totally off the cuff. I'm not sure that I know the answer, but I think it's like 50 to 75. So there you go.
Okay, what should I include in a first aid kit for my horse? How can I prepare for common emergencies? That's a great question.
That is a good question. The big things are, this is going to sound like a kidnapping kit as well, but diapers and duct tape are fantastic. Diapers make a great bandage for all kinds of things. So having diapers available, you can slap that onto anything that's bleeding.
Okay.
Duct tape will hold lots of things on.
Duct tape will stick to their fur.
Yeah.
Or hair.
We personally recommend Gorilla Tape because it's a superior product.
Okay.
I don't know if we're allowed to shout out, but that stuff sticks to anything.
Wow.
So we also just have some bandaging supplies we recommend owners have. There's a product called Vet Wrap that you can use to put temporary bandages on. Thermometer is always a good option. And scissors, because you never know what a horse is going to get themselves stuck in that you need to cut them out of.
Oh my gosh.
Right.
I would put
Yeah.
wire cutters on that list too, because if you have wire fencing, there's a high chance of your horse laying down and rolling at some point just to scratch
Getting
and actually
stuck.
sticking their foot through the fence.
And we'll put some disinfectants in there as well, you know, like betadine, alcohol, things you can get commonly.
Okay.
But yeah, thermometer, diapers, duct tape, you're pretty good to go.
Wow, diapers
That's a
and
good,
duct tape.
your horse first aid kit.
You
There
can
you
fix
go.
pretty
There you
much
go.
everything with diapers and duct tape.
And your veterinarian's phone number.
Yes.
Oh, well,
Oh, that's
Definitely
good. Yes, that
in
is
your
good. Yeah,
Yes.
that's good.
Yep.
How long are horses pregnant, and what special care do mares need during gestation and after foaling?
I love that.
Horses are pregnant for about 11 and a half months.
Wow.
Which can vary wildly.
Yes.
Really?
Really?
Yeah, it's a suggestion in horses.
Well,
For
that's
record, we have one at the clinic that went 399 days.
What?
Yeah.
Which is way more than a year if you're not doing the math.
Was the foal humongous?
Everything was normal. Yeah, and in horses, the mare really says how long she's going to hold on to it. And we often, you know, they get over 350 and us humans are like, oh, we need a baby. And so we'll check them, but I'll be honest, most times they're just fine. We just have to
fine.
wait until they're done,
Yeah,
and then they'll pop out
and
of
they
the
know
oven.
when they're done.
Yeah. And for the most part, the mares don't require a lot of extra care. Everyone's ready to do a lot of extra food. They don't need it. We do have a set of vaccines that we do extras of
Okay.
during pregnancy. And it's one of those respiratory virus. It was the rhinopneumonitis. It can cause problems with the pregnancy. So in particular, if they're around other horses, we make sure they get that one on a regular basis.
Wow.
But for the most part, it's just regular food, regular exercise. Probably not much different for humans.
Yeah.
I think the more important part of all of that is making sure that your horse is in shape before it gets pregnant and doing a lot of prep work ahead of time, because they need to be at a good body weight, and you need to do a lot of tests to make sure that they're ready to go in every way and make whatever adjustments you need to make before you get
The
into
levels of everything.
Yeah,
and-
pre-planning is really important.
That makes sense.
I would also have you ask if you really want to foal.
Really? Why?
It's quite a commitment.
Yeah.
It's
bet.
a lot cheaper to buy a horse that's already grown and survived all the bad things and is ready to go and trained and knows how to do the stuff, and you can just get on it and go instead of having to wait 7 years.
Oh,
If adult horses are accident prone, much like kids, foals are multiply that by 10.
so there's a
man.
lot of emergencies,
Yeah,
a lot
so
of things.
I always tell my owners, like, are you sure you want to do this? Let's have a discussion about it and make sure you really, really, really want to do this.
Oh.
Yeah.
What are the normal vital signs in horses? Body temperature, heart rate, etc.
Body temperature runs a little bit higher than us. They're normally in the 99 to 1015 range in Fahrenheit. Heart rate, very slow. They're Michael Phelps in Olympic shape. Their heart rate will be around 28 to 45. Horses' heart rates are one of those things that I recommend that owners learn how to do on the farm on their own. They can be a very good indicator to us that things are going wrong. Horses with a heart rate, sounds crazy. Normal heart rate is, like I said, 28 to 45-ish. A heart rate over 60, very, very bad.
Oh, okay.
Yeah, so a horse standing there with a high heart rate, that's a really, really bad thing.
Oof.
They also breathe really slowly, so somewhere in like the 12 to 14 breaths a minute is pretty normal for them.
Okay.
And those are the biggies we tell owners. We want heart rate, respiratory rate, temperature. You get us those three things, we know a lot about what's going on with your horse. And they're pretty easy to do.
How would you? I was going to ask that. You're like,
Yeah.
you recommend that they know how to do that, but how do you check your horse's heart rate?
We just buy a cheap stethoscope.
Oh.
Yep, you can probably get one on Amazon.
Okay.
Slightly more expensive makes it easier, but you don't need the high dollar ones. And you're going to listen right behind the elbow on the left side. So horse hearts are very, very easy to hear on the left, very hard to hear on the right. So you want to go on the left side, kind of behind the elbow, and practice, just figuring out where you can hear it. If your veterinarian is out for that twice yearly visit, we are happy to show you how to do it. And then respiratory rate, you're just sitting there counting a number.
Sure.
Oh,
They
yeah.
breathe. Yeah.
Okay, wow.
And then if you want to add weight periodically, that's a great thing too.
I was just going to say, if you're nervous, you can hot glue gun a dog leash onto your thermometer.
Oh, that's
You
a
could lose your
smart. Have you done that?
Nifty trick.
I've seen some crazy stuff.
What are ways to prevent ulcers?
So ulcers are something that horses are really susceptible due to the lifestyle that we have them living. So again, they were meant to live, out on the plains,
wild.
eating constantly. We tend to go more towards meals, and then they get ulcers from stress.
Oh.
And they don't always show us that stress, right? They can internalize, just like humans. So for that, we want to make sure that they're getting that roughage in front of them as often as we can. If we have horses who go into stressful environments, we have, like you've probably heard of Nexium or Prilosec or some of those for humans. We have those same drugs for horses that we try to use appropriately for the environment. So if we have a horse who's getting ready to go to an event, they're going to leave their home environment. They're going to be, stressed by other horses being around, maybe an increase in workload, something like that. We will treat those horses before that event to help prevent them.
Oh, wow.
But the number one thing we can do is keep roughage in front of them all the time. And alfalfa is a really great roughage to prevent ulcers.
Okay. Huh.
Yeah.
When purchasing a horse, what are red flags buyers should be aware of? Oh.
Buying one.
Yeah. Big red flag.
Yeah. Now, some of the things we look for is we don't have sort of a complete history. If you're talking to whoever's selling the horse and you can't really get the same answer more than once about something, I like to look at past performance records. And if that's, everything from trail riding to Olympic level, right? Like, what is this horse doing? What has it done? Can you show me where you've gone out on, multiple trail rides recently that this horse is able to do it? Do we have a consistent performance record that we don't see gaps in if it's a performance horse? Some of those kinds of things. The other thing that I find is a red flag is if I'm asking for veterinary records and they don't have any.
Yeah.
So another saying that I feel like we hear all the time is, oh, that's a horse pill. Do horses actually
Right.
take pills?
Horses used to, back in the day, before things were refined, things were different.
Yeah.
So
Oh.
I think we've gotten better at how we present things to them.
We do a lot of things where we take medications and modify them, a process called compounding, into something that is, apple or molasses or alfalfa flavored that the horses may like to eat. So we'll take that human drug and instead of being a pill, we'll put it into a mixture that has a lovely taste to it. Horses actually like bananas more than anything else. So it is one of the things where we'll help owners train them ahead of time so that they aren't as resistant to the process. We'll use applesauce or something that we can put into that syringe so we can train them that this isn't a bad thing.
It has been so wonderful to chat with both of you. I just want to know, for our audience's sake, is there any wisdom that you would like to leave them with when it comes to horses?
I would say think about getting into the shallow end first before jumping into the deep end. Find some place where you can be around them. You can, maybe lease one. You can start with lessons. See if it's something that fits into your lifestyle in a full-time way. I mean, I will warn you, like I said, it's an addiction. It led me to a career and a lifestyle, that's for sure.
Yeah.
But thinking about really, does this fit for you? Or is there a way that we can do it on sort of a lesser? Or do we want to jump in head first into the deep end?
Thank y'all so much. It was so great getting to know you and certainly learning a lot more about horses.
Yeah, thank you so much.
Again,
We
thank
love
you
being on the
guys.
show. This is great.
fantastic.
Yeah.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube. Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe.